Can occipital neuralgia cause tinnitus? Yes, it can. It can cause tinnitus in different ways. Number one, occipital nerves originate from C2 and C3 of the neck and form three occipital nerves, the greater, lesser, and the third occipital nerves. Now, those nerves can converge and go up into the spinal cord and the brainstem, and they can reach the trigeminal ganglia. They can reach the auditory pathway, and therefore, if they're affected, it affects the auditory pathway, causing tinnitus. Also, the tinnitus caused by the occipital neuralgia is called cervicogenic tinnitus, which is essentially a tinnitus that is on one side, and it has to do with movement of the neck. And the third thing, occipital neuralgia can cause muscle tension. It can affect the vascular supply of the neck, and therefore it can cause tinnitus. Now, how do I differentiate that the tinnitus that I have is due to occipital neuralgia? Typically, it's unilateral on one side. Number two, it has to do with the movement of the neck. So if I move toward the side of the tinnitus, it can improve. If I push on the occipital notch in the back, it will also improve the symptoms. It can cause pain in the occipital area, also typical for occipital neuralgia. Now, the diagnosis is based on the clinical history. The physician might order an MRI of the cervical spine or the brain to rule out other pathologies. Now, the treatment, we rely on treating occipital neuralgia, and the tinnitus should improve. So we can do occipital nerve block or dorsal median branch block in the neck. We can do physical therapy. We can do medications with NSAIDs and anti-inflammatories, and we can use also some certain medications to treat occipital neuralgia. But our focus would be on treating the occipital neuralgia, and the tinnitus will improve indirectly. Thank you.